What is mental health? Mental health refers to a person's emotional, psychological, and social well-being. How we think, feel, act. How we cope with stress. How we relate to others and make choices. A mental illness or mental disorder is when there are persistent changes in thinking, feeling, or behavior that cause significant distress, impair functioning, example like at school, home, and in relationships, can reduce your quality of life. Mental health problems facing Jamaican youth. From recent studies and reports shows that about 20 to 25% of Jamaican children and adolescents are estimated to have some mental disorder. Of those, 5% are estimated to have severe mental disorders. Common mental disorders in Jamaica among youth include anxiety disorders, major depressive disorder, attention deficit hyperactivity disorder, ADHD, post-traumatic stress disorder, PTSD, conduct disorder, and behavior problems. Mental health issues are being worsened by factors like social media misuse, poor sleep, comparison, etc. There is a large gap between how many youths need help versus how many are getting help. For instance, only about 7% of children with mental health needs are being met through formal services. Suicidal thoughts are a concern. There are reports that many students have considered suicide in Jamaica. Signs and symptoms to look for, especially in children. Children and adolescents may show mental health problems in many ways. Symptoms can vary with age, with the specific disorder, and with individual temperament. Here are the common warning signs. Emotional mood changes involves persistent sadness, hopelessness, teary mood, irritability, frequent crying or anger, mood swings that seem more intense than expected for age. Behavioral changes includes loss of interest in activities they used to enjoy, withdrawal from friends and family, socially isolating, changes in school behavior, poor grades, lack of concentration, skipping school, acting out, defiance, aggression, risk-taking, oppositional behavior. Physical symptoms to look for. Sleep problems, difficulty falling asleep, staying asleep, poor quality sleep, changes in appetite, eating too little or too much, frequent headaches, stomach aches with no clear medical cause, low energy, fatigue, cognitive changes to look for, difficulty concentrating, forgetfulness, trouble learning new things or keeping up in school. Other signs: excessive worry or anxiety, panic attacks or nervousness, suicidal thoughts or talk about death, self-harm, feelings of worthlessness or guilt. The question commonly asked: is mental illness affecting males more than females in Jamaica? The data is mixed. Gender differences depend on how you define mental health problem. Some key points. A Jamaican study of students aged 10 to 15 found 4.5% reported depressive symptoms. Gender was significantly associated. In many studies, girls show higher rates of anxiety and depression. A recent Caribbean meta-analysis found that mental health and behavior problems affect around 20 to 30% of adolescents. In Jamaica, girls seem to have higher rates of psychological distress, anxiety, depression. For example, about 40% of adolescents with disorders suffer from anxiety and depression, with a higher proportion among girls, 56% compared to boys. However, boys are not free of risk. Boys may show more externalizing behaviors like conduct problems, defiance, aggression, which sometimes are more noticeable. Also, cultural norms may mean boys are less likely to express emotional distress or seek help. These are some specific Jamaican student population findings. A survey by Capri found about 15% of Jamaican adolescents display symptoms consistent with depression or anxiety. In a study of 3,003 students aged 10 to 15, some 4.5% shows depressive symptoms, that while not all are severely affected, there is cause for concern. Very few students with severe disorders receive services in child guidance clinics in Jamaica. In 2018, only 4,000 children used the clinics, though tens of thousands are estimated to need help. Key risk and protective factors of mental health. Risk factors might include negative community attributes like violence, crime, insecurity, learning problems, or academic stress. Poor family protective factors like weak support at home, sleep problems, social media misuse, comparison, perhaps isolation. Protective factors include good family support, stable home environment, schools that recognize and support mental health, access to counseling, child guidance clinics, education and awareness, reducing stigma. In summary, mental health among Jamaican youth is a serious issue. Many are experiencing depression, anxiety, conduct disorders, etc., but few are receiving formal support. Girls tend to show higher rates of internalized problems like anxiety, depression, while boys more often show externalizing behavior. Early detection is critical. Signs in children may be missed if assumed to be just adolescent behavior or ignored because of stigma. There is a need for more resources, more trained child and adolescent mental health professionals, better access in schools, more public awareness, more support systems right across Jamaica.